Hello viewers, I am Dr. Sudipto De and I am a cancer surgeon based in Faridabad, Delhi NCR, India with a special interest in minimal access and robotic surgery. In this session, I'll be answering the most frequently asked questions about individual cancers. As April is Esophageal Cancer Awareness Month, I'm going to be answering some frequently asked questions about esophageal cancer. Now the first question obviously that arises is what exactly is esophageal cancer? Now esophagus or the food pipe is what connects our mouth to our stomach and helps in the digestion process. The cancer which happens in the esophagus can be of two different types. The first one can be squamous cell carcinoma, which usually happens in the upper 1/3 and in the middle 1/3 of the esophagus. Now, the second one is known as adenocarcinoma, which happens in the middle 1/3 and the lower 1/3 of the esophagus. The first question, or the most important question that patients do ask is, what is my survival with esophageal cancer? Now, the reason esophageal cancer is a bad cancer in our country is because of late diagnosis. In some countries like Japan, where there is a very eloquent and a very robust screening program, you can find a lot of cancers which are detected in stage 1 and 2, whereas in India people tend to ignore their symptoms and then land up in a stage 3 or a stage 4 cancer. The third question that the people do ask is then what are the symptoms that we should be looking out for to diagnose, or go to a doctor for esophageal cancer. Now, the main, diagnosis or the main symptom that esophageal cancer does have is dysphagia or difficulty in swallowing food. Now, if you have got difficulty in swallowing food that progresses over time, it is something that you should definitely go to your doctor to show it out and then get a proper diagnosis regarding that. What are the tests which are required for esophageal cancer diagnosis? The most important test here is to do an endoscopy, which involves putting a tube down your throat and getting biopsy samples and also having a look at the whole esophagus itself along with the stomach and the upper areas of the mouth. That gives us a very good indication of how the esophageal cancer is present. Along with this, we do a PET CT to see how widespread the cancer actually is. Now, along with this, a lot of people do ask is, how did I get this cancer, or is it related to genetics? Now, the cause of these cancers mostly are due to smoking, drinking. Along with that, we are also seeing patients who are obese and have got a lot of acid reflux have esophageal cancers. So if you are having these symptoms, do go out to your doctor and have a checkup to know what are the signs, symptoms and how to catch up on esophageal. Now let's come to the treatment of esophageal cancer. Esophageal cancer is one of the rare cancers which requires treatment from all the modalities of cancer therapy that there are. Now it requires surgery, it does require chemotherapy, it requires radiotherapy and also bits of immunotherapy to complete its whole treatment. Firstly, surgery, in which we try to remove the esophagus. Traditionally, this used to be done with 3 incisions, which is one in the chest, one in the abdomen and one in the neck. We usually use the stomach to replace the esophagus and join the stomach by moving it through the chest into the neck and then securing it and joining it across to the remaining esophagus. There's also chemotherapy and radiation therapy, which can be used either before or after your surgery to kind of complete the treatment. Now, this is where the 2 major malignancies which I had taught earlier will come into point. The squamous cell carcinoma requires chemotherapy along with radiation therapy, while the esophageal cancer of adenocarcinoma requires mostly chemotherapy in a sandwich way. Along with this, immunotherapy can also be used. It is used primarily in squamous cell carcinoma. Along with that, even in metastatic cancer, immunotherapy can be used. One of the major questions again that the patients do ask is what are the complications associated with esophageal surgery. Now, esophageal cancer surgery or esophageal resection is a very, very major surgery and a morbid procedure. because it requires opening up the chest, abdomen and the neck in itself. You can have a plethora of complications that can happen. The most usual complications that are associated with large surgeries, like you've got cardiac problems in patients who've got heart issues, along with that DVT or deep vein thrombosis. But the major complications which are very specific to esophageal surgery include anastomotic leak, which is leakage of the joint which is created in the neck or in the chest sometimes. Along with that, you can have pneumonia, and a later one complication can happen, which is known as stricture or a narrowing of the esophagus. Now, there's also another technique which does help reduce the morbidity and the complications associated with esophageal surgery, that is minimal access surgery or robotic surgery. It is usually done through keyholes or very small holes, which reduce the pain, thus reducing complications in the post-operative period and increase your ability to get back up on your feet again after the surgery. Recovery after esophageal surgery. As this is a major operation, recovery can take some time. With the traditional method of doing open surgery, you can be in the hospital from somewhere in the range of 7 to 15 days, including stay in the ICU for about a couple of days, which is the first couple of days. You might need to stay in the ICU. You are not started on food that fast. First, we allow the anastomosis of the joint to heal in the neck, and after that slowly water or liquids are started after doing a test somewhere around the post-op day 7 to post-op day 10, after which you can start taking liquids through the mouth. During this time, feeding is actually done through a tube which is placed either in the abdomen or through your nose, which helps maintain your nutrition in the meantime. This kind of a surgery, if done in a minimal access or robotic way, can enhance your recovery much more faster. You will be up and about from your bed and be able to move around with less pain. That will decrease your time of stay in the hospital once we have seen that you are able to tolerate the feed and can send you home early. Regarding other complications also, something like a pneumonia, that can also be decreased in the post-operative period if we have done the surgery by a minimal access or a robotic surgical technique. Because the incisions are smaller on the chest, it does not cause as much pain, and then you can take your breaths in much more efficiently, thus decreasing the complications like pneumonia. The chemotherapy and radiotherapy schedules can be based on the type of cancer that has been diagnosed on the biopsy. If it is a squamous cell carcinoma, usually the chemotherapy and radiation are given in a 4-week cycle before the surgery, and it can be followed up with immunotherapy if required. Along with this, if it's an adenocarcinoma, the chemotherapy is usually given in a 2-month long regimen where a cycle is given every 15 days or so to assess and see how the tumor is actually responding. The chemotherapy can last from somewhere around 2 to 4 months before the surgery and 2 to 4 months after. Do share this video with your loved ones who are suffering from cancer, and if you have any other questions, do let me know in the comments below. I'll try to answer them as soon as possible. Thank you.